All right, so we are back with another live stream to the Donald Trump, another Donald Trump press conference. He's apparently, it's been going for about a half an hour. I rewound it back to the beginning so I could start from the beginning. So if you're watching it here on the stream, you're watching it a little bit late. However, I did want to go ahead and get it from the start because if it's either going to be the Republican plan that was talked about a while ago, and my prediction, I haven't heard anything of this yet. So if he's regurgitating the old Republican alternative to the Affordable Care Act, the way that dealt with pre-existing conditions was pushed people with pre-existing conditions onto high-risk state pools that would basically bankrupt the states. So we will see if he goes with that or some other bad idea. But without further ado, let's go ahead and start this and see what we have to say, or what he has to say on this. So,
professionals, doctors, nurses, and amazing healthcare workers. Really an honor of mine. As the world witnessed during our battle against the China virus, America has the greatest medical professionals anywhere on earth. Today, I will lay out my vision for a healthcare system that puts patients first, families first,
his vision.
And perhaps most importantly for all of us, America first.
Because, Americans, people who are not citizens shouldn't be able to get health care? Is that what you're going for?
Under the America First healthcare plan, we will ensure the highest standard of care anywhere in the world, cutting-edge treatment, state-of-the-art medicine, groundbreaking cures, and true health security for you and your loved ones. And we will do it rapidly, and it's in very good order.
Because, the fastest thing is always the best, right?
In short, we're delivering better care with more choice at a much lower cost and working to ensure Americans have access to the care they need. My plan expands affordable insurance options, reduces the cost of prescription drugs, will end surprise medical billing, increases fairness through price transparency.
That's a good thing, but hopefully I think Biden's would do it as well.
Accelerates innovation, strongly protects Medicare, and always protects patients with pre-existing conditions.
How? That's what I want to know. Is that what I said before? Are you just going to push patients with high-risk pre-existing conditions onto high-risk pools?
The Democrat Party is pushing a socialist nightmare. Their plans will result in rationing care, denying
That's the same argument that was made
on wait lists, driving the best doctors out of medicine permanently, and delaying life-saving cures.
Sure.
Over 130
Joe Biden's running to cure cancer.
That's his moonshot. Senator Harris have endorsed legislation to outlaw the private health plans of 180 million Americans. On top of it all, former Vice President Joe Biden
that was the old thing that they said.
Health care to anyone in the world who illegally crosses our border. His plan to provide
everybody who illegally crosses our border is able to get free health care. Just go to the emergency room.
Collapse our hospitals.
They can't say, no, you're going to check to see if they have their papers before you do the surgery.
Millions of people lured into our country.
People.
As long as I am president, we will safeguard our borders and our seniors. We are pleased to be joined today by Secretary
Except for the fact that you downplayed the virus, which you said is harmful to seniors.
Alex Azar.
So therefore, you're not protecting your seniors by downplaying the virus.
And very importantly, CMS Administrator Seema Verma. Thank you, Seema.
Thank you, Seema.
A great friend of mine and a great friend of healthcare, frankly, Senator Bill Cassidy. Bill.
That's a joke. He's from Louisiana. That's a joke. That's a joke, right?
Michael Burgess.
Wasn't that a joke?
Murphy, so instrumental. Thank you, folks.
Oh, wait, he doesn't kid. So it wasn't a joke. He thinks he's telling the truth.
Officials are here with us. Thank you very much.
That's scary.
Since the plague arrived from China, we have seen our doctors, nurses, first responders, scientists, and researchers at their very best.
How many minutes of blathering before he gets to the details?
Life-saving treatments, reducing the fatality rate by 85% since April. Incredible. Overall, Europe has seen an almost 50% greater excess mortality rate than that of
We
the
have
United
4%
States.
of the world's population and
Despite Europe's
25% of the
punishing
world deaths.
lockdowns, they are now seeing a huge surge, very sadly, in cases. Under Operation Warp Speed, my administration is developing a vaccine in record time.
That won't be ready by the election, like you initially
before
said.
the end of the year, and maybe quite a bit sooner than that.
That's, he has to sugarcoat it because he has to make you think that he might get it done before the election.
A lot of things are looking very good. It is the most ambitious vaccine program in U.S. history, probably in any history.
The H1N1, the swine flu, under Obama, they got that out in 6 months.
So they can be delivered within 24 hours of approval.
You lost.
The vaccine will be safe and it will be effective. It will defeat the virus and it will end.
If you're politicizing the release of the vaccine, it's not going to be safe.
Record highs. You see what's happening.
That's why people aren't trusting it, not because they don't trust vaccines, because they don't trust
normal life will fully resume. That will be great. And next year will be one of the greatest years in the history of our country.
Because you won't be president unless, your coup continues.
When I was elected, I inherited a thing called Obamacare. Has anybody heard of Obamacare? It was terrible.
Mumbles.
That's the way I feel too. It was terrible and very, very expensive.
There are problems with the Affordable Care Act, but it's because Republicans wouldn't negotiate, so they had to get something through.
Patients had no choice. You couldn't keep your doctor. But by far the worst part of Obamacare was
I have a fat man rant about that. Watch that.
Individual mandate. As part of our largest ever tax cut in the history of the United States.
Okay, let me pause this for a second and talk about the individual mandate. Now, if you are going to eliminate pre-existing conditions, you need to also deal with anti-selection. You have to stop people from waiting until they get sick and then buying insurance. Otherwise, it no longer becomes insurance. So if you eliminate pre-existing condition clauses, you then have to put in a mandate to make sure that people are not just abusing the system. And if you don't understand what that means, if you don't understand pre-existing condition clauses, eliminating pre-existing condition clauses requires you to have a mandate to get rid of anti-selection. If you don't know what that means, then you're not qualified to have this debate on healthcare. You need to have a mandate in order to make sure that people don't just wait till they get sick and then buy insurance at that point. So this is the problem with the whole everyone in the mandate and how they don't get the mandate. And that being said, furthermore, which is why Roberts rested on the whole mandate being a tax thing. They could have worded it better, sure. But if all other things are equal, you pay less in taxes if you have insurance than if you don't have insurance with the mandate. Now, let's look at something else. With all other things being equal, you pay less in taxes if you have children than if you don't have children. That's how the tax code's written. If I make $100,000 a year and I have 2 kids, I'm going to be paying less taxes than if I make $100,000 a year and make no kids. If I make $100,000 a year and have insurance, I'm going to be paying less in taxes than if I make $100,000 a year and I don't have insurance. So, is there a mandate to have children in this country? No, it's just a tax discount. That's all it is. But, they had to word it in unfortunately, they had to word it in such a way that it's a mandate, instead of wording it as, you will get tax incentives to have health insurance. You will have to pay higher taxes if you choose to not have insurance. That's all that needed to be said. Democrats are terrible wordsmiths. I will grant you that. They should have just worded it that way. But at the end of the day, it's the same thing. And the American people are just way too picky. If they would have heard that, if they would have just said, if you have health insurance, you're going to get a tax credit. If they would have heard that, these Republicans would be like, oh, that's a great idea. Well, it would have been if a Republican would have been asked it. If there's a Republican that says, and I would love, if he says this, if he goes, I will offer Americans a tax credit for having insurance. If he does that, I am going to die laughing. I'm going to die laughing because that's going to be the same thing. Just wait. If he says that, that's my prediction that he could very well say. I mean, he might not say that. His plan might just not be terrible. His plan could very well just be Obamacare, just worded differently. Just like how he wrote his executive order. Anyway, let's go back to what he plans to do. I needed to go on a little rant for the mandate because the people not understanding the mandate just bothers me. Anyway, let's go back.
We put in a provision to kill this worst provision of Obamacare.
It's not the worst provision. It's needed.
It was a disaster, and it was really the essence of Obamacare.
It's not the essence of
It made you pay a tremendous
Obamacare.
amount of money in order to not have to pay for health insurance. Think of that. You had to pay
You pay more in taxes if you don't have
tax,
if you don't have insurance than if you do. It's a tax rebate.
It was really terrible and so unfair to so many, destroyed
Wait,
families.
I want to see that. I
We
want
were
to see him
able
say
to
it. If he says it,
terminate the
I'm going to
individual
die.
mandate, but kept the
I am
provision
going to
protecting
die.
Patients with pre-existing conditions that would
How are you going to do
not
that
have
without
been-
anti-selection?
That particular law would never have been signed if it were otherwise. Obamacare is no longer Obamacare. As we worked on it and managed it very well, we stabilized it and got premiums down very substantially.
Premiums.
That was Alex and that was Seema, and you did a fantastic job. But it's still unacceptable to me because it's too expensive and doesn't really do the job as well as we could have. So what we have now is a much better plan. It is no longer Obamacare because we've gotten rid of the worst
It's
part
now
of it, the
Trump
individual
care.
mandate,
I'm calling it Trump
and made
care.
it much less expensive. A lot of that was through good management.
Call it
We
Trump
manage
doesn't
it
care.
properly. We have tremendous people
We're going to call it
working
Trump
on
doesn't care. That's what it should be called.
Simultaneously with all of this, we are joining in a lawsuit to end this ill-conceived plan.
During a
And the court
pandemic,
to
you're going to
terminate
take away
this,
people's insurance.
Really, really terrible situation.
Tax
If
credits
we win,
that people are getting
we
for
will have
having
a better and
insurance.
less expensive plan that will always protect individuals with pre-existing conditions.
How?
If we lose, what we have now is better than the original
The
version
original?
of Obamacare by far. Much better, much better. Again, we will always protect patients with pre-existing
How
conditions.
will you
So
protect
today
patients with pre-existing
laying
conditions?
out my vision for the future of American healthcare with the America First healthcare
Rich people
plan.
get everyone
As
else
we
is
restore
screwed.
America to full strength, the first healthcare plan will be a core part
If you
of
missed
our
the word,
national
America
renewal.
First. You said the first
In a few
healthcare
moments,
plan.
I'll sign an executive order outlining the 3 pillars of my plan and directing my administration to implement these critical reforms.
So you're not even going to
First
pass a
pillar
law.
of my plan is more choice for the American patients.
How? How are you implementing more choice? I mean, it's nice to say words, but the words have to have meaning, have to
The
have
last
the force
administration
of law.
severely restricted
It's not
consumer
law.
choice through the greatest healthcare lie ever told. If you like your plan, you can keep your plan. If you like your doctor, you can keep your
I have a
doctor.
fat man rant on this. I'm not going to
Remember
talk
that?
about that
28
right now.
times that was
Go look at
stated
one
by
of
our
my first
president,
fat
but
man
it turned
rants
out not
on
to
my
be true.
channel, and you'll see
When
it.
I took office, more than 50% of counties nationwide offered plans from only a single insurance company on the individual market. Starting next month, more than 90% of the counties will have multiple options to choose from, which is really
What
some
will they be?
difference.
And most of the counties, again, he's talking about counties. He's not talking about population. He's talking about
Under our
counties.
plan, you'll have the freedom to shop for the option that is right for you and your family. These options include new affordable choices that cost up to 60% less than Obamacare. Think of that, 60% less. For example,
How?
we're opening up short-term plans that are much cheaper than Obamacare.
Short-term plans. You
and
don't
that
need a
can
what-
be
what's good's a
customized
short-term
to your
plan?
individual needs. We're also offering association health plans that allow small businesses to pool together and offer more affordable policies to their employees. These are tremendous options that didn't exist before we came into office. And through a massive expansion of health reimbursement arrangements, millions of Americans will be able to shop for a plan of their choice on the individual market and then have their employer cover the full cost. Furthermore, I'll work to make individual health care premiums fully tax deductible. That will be a big difference.
If you have, if you're tax deductible, you're getting a credit.
Through these and
Again,
other reforms,
not
we're
quite
putting
where I
American
was.
patients back in charge, and we're putting them first. My plan will also revolutionize access to telehealth. It's something that really has taken off during the pandemic. It's taken off like a rocket ship.
Yes, America has gotten telehealth done because we
It's
can't go to the, we couldn't
increased
go to the
close
doctor for certain things.
9,000%. Nobody was using it, and when we had the pandemic, They started using it, then they started really liking
'Cause
it,
we
then it
had
started
to.
getting better and better. Bill, now it's up to 9,000%.
I downplayed the virus, making it much worse than it had to be. So therefore, we had to use telehealth, and I'm taking credit for it.
When we rapidly expanded its
absurd.
availability for Medicare beneficiaries during the pandemic, the number of telehealth users increased so incredibly to 14,000 a week. It was 1.7 million. It was increasing at levels that nobody's ever seen before in just about any kind of a program. This is the future of healthcare. We will ensure all Americans have the freedom to consult with doctors from the safety and convenience of their homes. The second pillar of my plan is lower costs for families and seniors. Lower cost.
How? How are you doing it? So here we go. Lower costs. I'm waiting for it.
Patients have been shocked to receive unexpected bills for thousands of dollars in medical
not
services.
that. Okay, I'm waiting for him to say what I'm
agreed
thinking
to.
he's going to say.
The first America First healthcare plan bans this deeply unfair practice. We will end surprise medical billing. The days of ripping off American patients are over. My plan also includes the vital reform of price transparency.
How are you doing this without laws? That's what I want to know. How are you doing it without a law?
And price transparency
Y'all don't like
is great for
talking
the great
about,
doctors,
you
the
know,
good doctors,
executive
and
orders
it's
when Obama
also
does it.
great
How is
for
this
the
being done without a
great
law?
and good hospitals. That's where it's really fantastic for them too, in addition, obviously, to the patients. For the first time ever, we will create true competition in healthcare. Both hospitals and insurance companies will be required to post all of their prices online. This transformative policy will allow you to see your exact out-of-pocket costs before you go for treatment, making it easy to shop for the best price. Costs will come way down. Some people think this will have a bigger impact than
Many
healthcare
people
itself.
I've talked to. That's you know
No matter
that
where
Donald
it's
Trump
been
is
put, it's
lying
been an
when he
incredible
says some people I've
service,
talked
and
to.
It's worked miracles.
Some
It's been
people I've
brilliant for
talked to.
patients.
That's how you know
Next
Donald
time,
Trump is
taking on
lying.
the lobbyists and the special interests to lower the price of prescription drugs. For years, American patients.
If you watch, I have another video on this particular thing, or maybe it was on my podcast, one of the two. Donald Trump's executive orders
we talk about
dealing
it all
with
the
the
time.
EpiPen
Congress, they come
and the
over,
other
we've been
drug.
talking about it for a long time. They've been talking about it for years.
What was
They
it?
know
The EpiPen
problem,
and something
but
else?
We've been subsidizing socialist
0.3% of all Americans would benefit from that
by paying the highest
executive
drug
order.
prices in the world by far, and yet we're the largest purchaser of prescription drugs by far. And this is all while countries got away with paying so much less. Incredibly
So if we demand
less.
it more,
Under my
wouldn't supply
plan,
and demand dictate that we
will
would pay
the
more?
exact same price
I mean, yes,
as
we
other
should cut
countries.
prices.
That's
You
at the
know,
lowest
we
level.
shouldn't
So we will
reward
be matching the lowest price
companies that
with
get
what's
protected
now
with patents
many
by
times
letting
the
them
highest
also
price,
charge ridiculous
and we won't
amounts.
pay a penny more. What will happen is the lower prices will come up a little bit, but you'll get discounts of 40, 50, 60, 80, 90, who knows, percent.
Who knows?
Numbers
Nobody
that
knows. You
wouldn't
don't
even
know.
believe. And we
You're
were the only
town.
ones in 52 years to bring drug prices down. The last year they went down, as you know. But that was before this. They went down just a little bit, but just a little bit was the only time in 52 years. Now they're going to go down massively. Favored nations. This will lead to a very large savings for American families and plummeting drug prices. They will plummet. The
How do you know?
Obama-Biden
There's
administration
no way to know.
gave to big pharma and allowed drug prices to explode. The only bad part about this transaction is that they are advertising like crazy. Make sure you don't elect Trump. And all it means is that your drug prices are coming down. So it's incredible. They have unlimited money for ads, but they're taking ads, and every time you see an ad, just think that your drug prices are coming down. I now understand why other politicians wouldn't do it, because it was a very easy thing to do. But it took a certain amount of courage, I will say that.
What the hell?
So it means that I'm taking on big pharma like never before. Nobody's done this before. They understood favored nations. Favored nations is you get the best price as the lowest, no matter where it is, anywhere in the world. So if Germany's paying 10 cents for a bill and we're paying $2.50 for the same exact bill from the same place, same plant, same genius scientists, same everything, same laboratory. We get the same price as they do. You're talking about numbers that are unthinkable. Favored nations.
I can't think. That's why it's
so
unthinkable.
It's really something, and they're attacking me viciously. We know that, and they're attacking me really because I'm fighting for you. But it's worth the fight. It's worth the fight. I think people are going to understand. And I can say this, I think. I don't think it's confidential. Our chief of staff is here, Mark Meadows, from a very great state known as North Carolina. Yeah, happens to come from North Carolina. That's good stuff. He wanted to be here for that reason, probably more than even listening to this because you've heard it. But Mark will tell you that Big Pharma is calling and negotiating, and they want to make a deal. And there's a deal somewhere, but
there's a deal somewhere.
It's
somewhere
that's taking place right now. So they're negotiating, but this is where we are, and they're negotiating for one reason. Before that, they wouldn't even think about negotiating with any other administration. They cannot believe this is actually happening. And if we can make a deal, we will. But Mark, you're negotiating literally as we speak, right? So
not if he's sitting there at a press conference.
Okay. So that's great. Now, Mark is a real pro at this, understands it. Complicated business, but he understands it very well. Today, my administration's taking action on every piece of the executive order I signed on prescription drug importation in July. The American people pay an average of over, listen to this, 3 times more for medicine than Canadians. So you could be 2 feet away on each side of the border, 3 times more. And that's the way it is. Canada is far more than many other countries. My plan will allow states, wholesalers, and pharmacies to do something career politicians have promised for decades because it was very simple as an idea, but never delivered. We will finally allow the safe and legal importation of prescription drugs from Canada. So this means a state or whatever can go to Canada and buy your drugs for a fraction of the price that they're charging right now. Massive numbers of, tremendous numbers. Florida wants to do it, Colorado wants to do it, many states want to do it, and they will be doing it, but that's still higher than the favored nations. So as favored nations kicks in, I think that probably beats everybody, no matter where you are, no matter where you're trying to buy. This will be a game changer for American seniors, and by allowing you to do this through Canada, we're doing it very, very quickly, so it goes very fast. And the new rule goes into effect as of today. Is that fast enough? I think so. What do you think?
Warp speed.
Congressman. The America First health care plan includes another historic provision to benefit our great seniors. Under my plan, 33 million Medicare beneficiaries will soon receive a card in the mail containing $200 that they can use to help pay for prescription drugs. Nobody's seen this before. These cards are incredible. The cards will be mailed out in coming weeks. I will always take
they're going to be right there November 2nd.
Joe Biden won't be doing this.
$200. That's all. That's a.
This is also partially because of the tremendous money that we're going to be saving with the favored nations and various other things that we've done. We've approved more affordable generic drugs than any administration in history. I had no idea, but I had had many doctors who I have great respect for, by the way, come to me and I said, well, what's the difference between this and this? One is a very well-known name. One is just a pill in a bottle with no tag on it. And they said, zero. I said, must be a little bit better, right? The name zero. And yet the name brand will cost 5 and even 10 times more money than the generic. So we've approved more generic drugs than anybody at a rapid pace too. We're also requiring that low-income patients receive the benefits of government discounts on insulin and the EpiPen, and that, that is a big
Except that only helps 0.3%. Again, I've covered that already on this channel or in my podcast. I forget which one I did that on.
And this is something that SEMA worked on so hard.
I think it's the podcast.
Insulin prices soared under the last administration. like you wouldn't believe, right, Seema? Under my plan, hundreds of thousands of Medicare patients will see their insulin costs capped at just $35 a month. That's a 66% cost reduction. And this feature will be available on over 1,600 Medicare plans that seniors can begin signing up for starting October 1st. And under certain circumstances, Seema, it's literally almost free.
It's literally almost free.
They were just ripping you on is close to being free, even lower than the $35 a month. So you did a fantastic job in that. Thank you very much.
Literally almost free. Is that so? Not free?
Seema would come to my office, sir. I have something so exciting. She worked on that for a long time and getting that done, but it is exciting. If you need insulin, a lot of people were going without it. They just couldn't afford it. Now they can definitely afford it. We'll accelerate our relentless effort to save seniors money on their premiums. Since I took office, we reduced Medicare Part D premiums by 12%. Medicare Advantage premiums are also down dramatically, a 44% reduction in North Carolina. It's good. 43% lower in Pennsylvania, and a 54% lower price in Michigan. So that's something
blue states
we have
didn't matter.
all over the country. All over the country, there are numbers just like that. We'll ensure that all seniors pay the same price for the same service, whether at a hospital, a surgery center, or a doctor's office. This will save seniors billions and billions of dollars a year. We're talking about the
$1 billion.
And it also saves our government a lot of money, but will save our senior citizens billions of dollars a year. Fantastic job. We're putting into place the largest package of saving for seniors of any administration in history. No administration is even close to what we've done, and I've said it, having to do much more than even health care. There's no administration in its first 3.5 years that's
very
done
disappointed. This is a nothing burger, pretty much.
And I never even get
this whole thing is a
criticized
nothing
for saying
burger.
That must mean it's true, right, my congressman and my great senator? Under the Democrat plan, costs will skyrocket. Our seniors will lose the benefits they paid into their entire, they've been paying for their entire lives, tremendous amounts of money, all to finance socialism and open borders. We're just helping other countries, countries that aren't even friends of ours. But we help our friends, and we help socialism all over the world, and we hurt our people, and we're not doing that anymore.
Our people.
As long as I'm president, no one will lay a hand on your Medicare. Your Medicare is going to be safe, and it's going to be solid.
I don't want government touching my Medicare. And someone actually told that to me during the Affordable Care Act.
The final pillar of America First healthcare plan is better care. That's better care for American patients. The historic action I'm taking today includes the first ever executive order to affirm it is the official policy of the United States government to protect patients with pre-existing conditions. So
you already wrote that executive order. That's meaningless. It's not.
Our opponents, the Democrats,
Let's hear that again.
Talk about it, and yet pre-existing conditions are much safer with us. We're just helping other countries that.
Oh. Hello.
That's better care for American patients. The historic action I'm taking today includes the first ever executive order to affirm it is the official policy of the United States government to protect patients with pre-existing.
That's the official policy. It's been the official policy since they passed Obamacare. You dumb. Oh my God, you're so stupid.
The Democrats like to constantly talk about it, and yet pre-existing conditions are much safer with us than they are with them.
You're trying.
Now we have it affirmed.
How?
This is
pre-existing conditions. Donald Trump. Let's do the breaking news. The breaking news. Donald Trump said that he believes pre-existing, you're watching me, conditions are safer under his administration as he tries to dismantle the affordable. Let's just say the ACA. The ACA in the courts. Obamacare. Hashtag Trump doesn't care. That's just mind-boggling. That's just mind-boggling. It's ridiculous.
Affirmed, signed, and done.
It's been the policy, national policy.
Anyway, because it's disinformation.
National policy since the Affordable Care Act passed that pre-existing conditions are protected. But this is the first time.
Remember during the last campaign 4 years ago, they kept saying I was going to destroy Social Security. I made Social Security stronger, better. They will be the ones that destroy Social Security because they're going to destroy our country. They will destroy our economy. So Social Security, nothing happened. I keep saying, whatever happened to Social Security? Remember? He is going to immediately attack. No, just the opposite. Your Social Security is 100% with me, but it's not 100% with them.
Except you're cutting off the funding source.
Any healthcare reform legislation that comes to my desk from Congress must protect the pre-existing conditions, or I won't sign it. And I made that pledge, and I made that pledge last week.
We don't believe you. We don't believe you. And how it does it is the problem. If you back the Republican
lie is that they will cover pre-existing conditions, but in truth, the socialist takeover, economic shutdowns that they talk about, if you look at this state, frankly, where you have Democrat governors, Democrat leaders, those states are in very bad shape with all of their shutdowns. Pennsylvania, you take a look at what's going on in Pennsylvania.
What is this word salad?
We just won a big court case where a judge...
federal
judge ruled it unconstitutional.
He's gone the plaid. He's gone mental.
There's damage on the other side of a shutdown. People don't realize with suicides and
what does that have to do with pre-existing conditions?
Alcohol
causes.
It's a terrible thing that happens. And Michigan's another state. The shutdown is very severe. By the way, on November 4th, I'm sure everything will be open. They'll announce on the evening.
November 4th, Biden wouldn't be president to begin with. If you're going to make this argument, make it January, end of January.
Come in for weeks and weeks and weeks. You know, they want them to.
You don't even know how government works, and you want to lead it.
Well,
I mean, you don't want to lead it, but you want to be the person who's called the leader. You want the title. You don't want the responsibility.
Illegal immigrants will collapse. Our economy will collapse under their system and make your healthcare system.
He just gone several different places, and what happened to pre-existing condition clauses?
What they're doing is socialized medicine, and it's not acceptable. It's going to be a disaster in terms of quality.
Where's the ballots? He has to talk about the ballots now.
Under their plan, you'll lose your doctor again, and you will lose
your doctor again.
You will lose everything having to do with what we're talking about.
See my fat man rant about that.
Watch, I will never let the radical left take away your health care. You'll always have health care.
You are full of crap.
The America First health care plan will deliver another long-awaited reform. We will put you in control of your own medical records.
Am I going to have to carry a thumb drive?
We'll require doctors to make your records available electronically, and you'll own them, and you'll control them, and they will be portable, and you'll be able to work seamlessly with all of your medical providers. It'll make your life a lot easier. Much, much easier. The previous administration.
I don't know how much of that is not true currently, but I mean, how do I believe that what he's going to do is going to change what is done currently when he's arguing that he's going to be he's the first president to protect pre-existing conditions?
Patients access to life-saving treatment. I also signed Right to Try. You know what Right to Try is? I'm very
fine with Right to Try.
Right to Try is,
Right to Try may be the only thing he's done good in this presidency.
I think I'd like to do, I'll do it really quickly. I'm going to run through just.
And even then, it's not right to try everything. It still has to be approved by the FDA.
We've really become the healthcare party, the Republican Party, and nobody knows that. The news doesn't talk about it. But I'm going to just say, it's a list of things that we've done, and.
This is like the paper went from the Axios video. Look at this
sheet. I'd like to read that to the audience of professionals today. And this is just a partial list. We repealed the individual mandate.
which
eliminated
is not good.
Obamacare's health insurance, medical device, and the Cadillac taxes. That's a big deal. People forget all of this.
People.
They say, I wonder who did that. Could it have been Joe Biden? He doesn't know what it is. Expanded association health plans.
Notice how like a smattering
Increased
of
availability
people
of
are
short-term, limited duration
laughing.
plans.
Most of the room is silent. Smattering of people
Expanded
applauding.
health reimbursement.
Now, I don't know how many
arrangements.
people are in the room. This might not be your
Lowered
typical
prescription drug prices,
Trump press
and
conference.
you will
These
see
people
them
might be
at a level
taking
that
because
you
they're
will never have-
doctors and nurses. They
you'll
might
never
be
see this
socially
again.
distant.
They will go down so low. And as I said, we had the
Solo
largest
behind Solo.
annual decrease. We had the only decrease over a 52-year period. More generic prescriptions approved, saving America an estimated $2.6 billion in the first 18 months of
Billions.
the administration alone. So in 18 months, we saved $2.6 billion with generic drugs. Signed 4 executive orders to lower prescription drug prices.
One of them
Signed
only helps 3%,
legislation
0.3% of the
banning pharmacy
population,
gag
I remind
clauses.
you.
Does that make sense to you? I mean, what people were under and what even the pharmacists had to do was it was embarrassing to them. Took executive action to ensure price transparency in healthcare. That'll be one of the biggest things, and most people have no idea what it means. I said, some people said that's bigger than healthcare. Required hospitals to post standard prices on the internet. Modernized and strengthened Medicare with more options, more benefits, and lower premiums substantially.
Premium.
Improved kidney care, such a big deal, with more transplants and better treatment. Kidney care is so tough for people with a problem. Very substantially.
Healthcare
lowered the
problems
price
are such
of
an issue,
insurance, we said, for
are hard for
seniors.
people with those healthcare
Invested
problems.
in advances in generic therapy for sickle cell disease. Big thing, big thing, big thing. Launched a $500 million initiative to find cures for childhood cancers, $500 million. Combated drug demand. We really went very, very strong on drug demand and the opioid crisis with expanded access to medication-assisted treatment and life-saving naloxone.
Relax off.
Opioid prescribed decrease by over 35%.
That's not
So if you
necessarily
look
a
at,
good thing. If
the
this opioid issue,
obviously,
they've thrown the
horror
baby
show.
out with the bathwater.
Decreased by over 35%.
There are people who need to take
since
opioids who
January
can't
of
because
2017.
of
We
the
worked very, very
over-the-top
hard.
way in which
Launched
the government is going after the
FindTreatment.gov
prescribing of opioid
to
drugs. There are
connect
people
those
who
with
need the drugs.
substance
They
abuse
should be able to
disorder
get
to
them,
treatment.
and they
We have an
can't
incredible
because y'all are being
situation.
ridiculous schmucks.
FindTreatment.gov. Passed right to try to give critically ill patients
You already
access
said right to try.
life-saving cures where it hasn't been approved yet by the FDA. Incredible. And by the way, many of you know what that has meant. We have had some examples of success that on right to try that have been amazing. Launched an initiative to end AIDS, HIV/AIDS. In America, we think in 6 years it will be largely eradicated. Who would have ever thought? And this could have started 2 years before I got there, but they chose not to do it. But we have, and we've launched the initiative. It's into its almost 4th year.
Does he believe the
And,
things that he
at the time
says?
we
I
did
mean,
it, it
is
was
he
gonna
that
be 10 years.
crazy
At the end
or
of
is he
10
that
years. Now 6
ridiculous?
years, we're already down to 6. It will largely eradicate AIDS, HIV/AIDS in America. Who would have thought that? It's incredible. When I first heard about it,
I ordered the burger with no AIDS.
When I first heard about it, I said, why wouldn't they have started it early? But they didn't. Expanded access to telehealth, especially in rural and underserved areas, telehealth. Signed historic VA choice legislation. That's a big deal. That's a big deal. And
Huge.
it's the real
Huge.
choice, not the weak choice, the very, very weak, the choice that didn't mean anything. But it's been a tremendous success, and we just got a 91% approval rating from our vets, the highest we've ever had by a lot, the highest. And we also, while we're at it, we signed accountability, VA accountability. That's where people don't love our vets. If they don't take care of our vets, you couldn't do anything about it. They'd have to live in hell with these vets, with the people that were supposed to be taking care of them. And we have a thing called VA accountability. They're accountable now. If they don't treat our vets great, if they don't take care of our vets, if they don't love our vets, our country, we can fire them. We can say, you're fired. We can fire them. VA accountability. That's a big thing. So VA Choice, VA Accountability took executive action to prevent veteran suicide and launched the 24-hour veteran hotline for suicide. And it's really working. And signed the largest ever increase in child care development block grants. Those are just some of the things that we've done. We've done actually a lot more than that.
Yeah.
We have to get back to business here, right? Those are things that we've done.
We need to make sure that people don't die from COVID.
Look at a list like that. Democrats have never done anything like that. Under the Democrat socialist agenda, an avalanche of regulation would extinguish
The socialists
the claim
of
excellence
the
that makes America
left
the center
would disagree
of
that Joe
scientific
Biden's plans is
discovery, groundbreaking
socialism.
treatment,
They would love to
and
see it be
life-saving
socialism.
cures.
But of
In
course,
our all-out war
you know,
against
the
the
whole
virus, we've
what's
lifted
left,
bureaucratic
what's
barriers
left,
and
what's
marshaled America's
progressive, what's
scientific,
liberal,
industrial, and technical
what
brilliance,
those
and we do have
things,
total brilliance. Some of
while
us in
people
room,
on
by
this
the way,
side may
should
feel
know
that there are huge differences,
I will apply.
Trump is so far to the right that
Right,
the
Bill?
differences look minute.
Some incredible people in this room. I'll apply the same determination to accelerate medical breakthroughs in all areas, including for Alzheimer's, diabetes, generic treatments for sickle cell disease, early detection of cancer, and much, much more. Already to improve care for Americans with kidney disease, we enable
Didn't you
patients
just
to
talk
receive
about
at-home
kidneys?
dialysis. And we're investing in the creation of an artificial kidney. We're getting very close. And we introduce critical incentives to make more kidneys available for transplant, a change that will save tens of thousands of lives. What people have to go through with kidney disease
He's just
is
repeating the
incredible.
same things over and over again in this
They work
press conference
so hard. I said,
or
how do
whatever.
They do? They can live a long
So his
life,
healthcare
but
plan's
so
not
much
really a
work to
proposal
do
for
it.
a law.
That they
It's just a
literally-
bunch of
one doctor told
executive
me that
orders
they die of
that
hard work. It's such a
are
big
either
job
redundant
to go,
or
I guess dialysis, etc. It's such a hard
just
job.
things that we
They
can't
die
believe
of-
because he's
of
proven himself
literally,
to be a
they die
liar.
of just hard work.
That's so far what this. That's so far.
It's
That's so far.
incredible what
That's
we've
just what we've
done
learned so
there
far.
and what we're
Easy
doing
for me to
and-
say.
Especially with some of the research that's been done, what we're coming
For
up
the
with.
big
You'll be
bump.
seeing it very soon, I believe. As we invest in the future, we will permanently bring our medical supply chains back home. We will produce our medical supplies, pharmaceuticals, and treatments right here in the United States, right here in North Carolina. We're going to bring a lot of business too. If you remember, Puerto Rico used to do it, and then they brought tax legislation that destroyed that whole thing. They all left, but they were very happy in Puerto Rico. We're going to bring it back to Puerto Rico and many of our states that will be doing it. And North Carolina, I see, is on the list as being a very top one. So we're going to bring it back to North Carolina, the country.
North Carolina, the country. What?
And
What?
will reverse the disastrous and heartless decision Joe Biden made in 1996 to shut down the pharmaceutical industry in Puerto
Industry.
Rico. It took place
Why
in
does he put the emphasis
1996.
on the wrong
Biden
syllable?
Shut down the whole Puerto Rico industry. This was a very good industry. They were doing a fantastic job, and
This
one day it was
industry
just
was-
literally gone. Biden shut it down with what he did with taxes, and it was a disgrace. But we will bring it back. Under our leadership, American medicine will make the biggest breakthroughs, the largest leaps, the most exciting strides,
I'm sure they won't.
and the most outstanding discoveries. Before I sign a historic executive
'Cause so
order
many people who have died of
implementing
COVID
this
who have learned
ambitious
so
agenda,
much.
Let me introduce two Americans, great Americans, who will benefit from our policies. Julia Strathopoulos was born in Freeman-Sheldon syndrome, or with the Freeman-Sheldon syndrome, which is tough, an extremely
tough.
rare muscle and bone
tough.
disorder. Under the previous administration, Julia's family saw their premiums on the
Premiums.
individual market skyrocket to $3,000 a month. And
Where
more.
are these plans?
Parents had to go
I don't
without
believe that
health
because I've
insurance just
seen.
to afford coverage for their children. Since I was elected, their families' premiums have been slashed by more than 40%, and we're going down further.
Like people say that these super high premiums, are they buying the Cadillac plan? The super, we're gonna massage your feet and take you out to dinner plans.
Thank you.
The Cadillac plans. Is that what the plans that they had?
You're great, Julia.
I mean, my bronze plan, yes, it's high deductible, but it's not.
It's a great story, but we're inspired.
It's not that expensive anywhere near. It's $900 a month for the entirety of the family to be insured.
From nearby Concord. After spending less than 24 hours in the hospital and receiving a few basic tests, she received surprise bills that added up to $4,000. That's a lot of money, despite having insurance. Sharon, those days will soon be over because we'll end surprise medical billing once and for all. Where is Sharon? Hi, Sharon.
Sharon!
That's why they call it surprise billing. She got home and she was surprised. They sent you the bill, you opened it up, you thought it was going to be $25.
I have no faith that Donald Trump is going to stop surprise billing.
Well, we're taking care of it.
Either,
thank you very much.
because
we're standing up.
I'm sure there's going to be some loophole that they're going to be able to use.
We're standing up to special interest. We're taking on the powerful lobbyists. We're stopping the radical socialists and communists, to be honest with you. I think we've gone a little bit above socialism or below it, if you want to call it that way. But we are standing up to both, whichever one you want to choose. And we are fighting for the incredible people of North Carolina. They're incredible people, people I love. I love the people. We named, as you know, my grandchild is named Carolina, so.
These people.
Beautiful Carolina, my most beautiful child. But we're providing better care and more choice at a.
I would ask why WhiteHouse.gov, the official WhiteHouse.gov Twitter YouTube account is airing a campaign ad, but all of his press conferences pretty much are campaigns at this point.
Proudly putting America first. That hasn't happened for a long time.
No, you're not. You're not putting America first. You're putting rich and wealthy people first. You're putting white people first. That's what America First historically was.
I will now sign
to be xenophobic.
The executive order. I want to thank you all for being here. God bless you. God
executive
bless
orders.
North Carolina, and God bless America. Thank you very much.
I don't believe there's going to be any questions. We can try and fast forward ahead to see it. No, it doesn't look like there's going to be any other questions as part of that live stream. So nobody asking him questions about his questions about how he wants to toss ballots and throw away ballots. So that ridiculousness happened yesterday. If I would have held a live stream yesterday, I would have maybe said things that I would have regretted, because holy crap, the idea that he wants to ignore ballots, throw away ballots. I made a little TikTok about this because it's still around, even though you can't download it apparently. The presidential campaigns have internal polling, and a lot of times the campaigns maybe trust their internal polling more than they trust the external polling. If Donald Trump's internal polling had him winning this election, they wouldn't be casting doubts on the results of the election. That tells me that Donald Trump's internal polling has him losing so miserably that the only way he feels that he's going to be able to maintain or retain the presidency is to cast so much doubt on the results even beforehand and make it seem like it's a big fraud beforehand, that then when it comes time to challenge the results of the election, that people say, well, he said it was a fraud, so now it is. And then he's going to want to take it up to the Supreme Court. And that's why he's in such a hurry to name a successor, name somebody who is going to fill the vacancy left by the passing of Ruth Bader Ginsburg, because he needs the Supreme Court to be 5-4 in his favor, because he doesn't trust Roberts is going to rule in such a way that will allow him to throw away potentially millions of ballots in order for him to retain his presidential seat. And because, look, and I intend on making several a video series about this particular thing, the idea of the whole, that there's the Trump coup, but then there's the GOP coup as a whole. And that's been going on since 2010 at the latest. Maybe it even happened a little earlier. But I'm going to be doing some videos on that, making more Fat Man rants, making more coming to terms of activism videos, and I'm giving you the subscribers of the channel, you, the backers of the Patreon, I should say, the Patreon people will get to vote on what they want to see next, what they want me to work on next. I'm going to give that to y'all hands, but y'all have to vote on it. Y'all have to, in order to vote on it, y'all are going to have to pay the Patreon. It's $10 a month is going to give you that access, the ability to help drive the show. Maybe we'll call those the producers at this point to kind of follow what Nimbus Yosh, the host of the Most and the Percy podcast, does as well. Anyway, that's the end of this one. If you follow me still, if you're still listening, I'm going to be doing a nerdydan.com on youtube.com/nerdydan.com. I'll be doing that later today, probably playing around, having some fun with it. But I did want to get this press conference covered because it had been a while since I've done a live. So anyway, thank you very much. Stay safe, stay healthy, mask up, stay socially distanced, and have